House Bill 1982, otherwise known as the Mental Health Access and Gun Violence Prevention Act of 2017, was introduced to address two main issues. The first issue being increased access to mental health services and treatment in America. This would be done by allocating funds to improve the amount and quality of mental health care. It would also serve to prevent individuals who meet certain disqualifying criteria from gaining access to firearms. This would be accomplished by encouraging mental health professionals to report relevant mental health information to the National Criminal Background Check System. Many may wonder, why is this policy so important? According to the National Alliance on Mental Illness, 1 in 5 Americans will suffer from a mental illness in any given year. Many of these 43.8 million Americans will either decline or be unable to access mental health services. Mental health issues are frequently misunderstood by the general populace, thus creating a stigma that most individuals do not want to be associated with. Those who choose to brave the stigma by seeking help are often faced with prolonged wait times, unaffordable medications, and the potential for subpar treatment from an overwhelmed system. There are simply not enough mental health professionals available to meet the need. Despite the media's frequent reports of mentally unstable gunmen committing acts of mass casualty, it is important to note that individuals who suffer from a mental illness are far more likely to be the victim of violence rather than the perpetrator. This blatant misrepresentation of mental illness only adds to the stigma and broadens the gap in care. It is also important to note that suicide is the leading cause of gun-related death in the United States. Many of these deaths could have been prevented if appropriate background checks had been completed. It is just far too easy for individuals who do not possess the ability to manage a firearm responsibly to access one in the United States. House Bill 1982 was written and proposed to Representative Sheila Jackson Lee, who was the initial sponsor for this piece of legislation. She introduced it to the House and Senate on April 6, 2017, and has since been referred to the Subcommittee on Crime, Terrorism, Homeland Security and Investigations, the Subcommittee on Health, and the Committee on Energy and Commerce. The above committees will have to review, research, and potentially revise the bill before either sending it back for approval or to the House floor for more information. After the representatives have debated HB 1982, a vote will be taken. If the bill passes, it will then be referred to the Senate, and another vote will be taken. If the majority of the representatives support the bill, it will be sent to the President for approval. It will then either fall to the President to either veto or pass the bill into law. Representative Sheila Jackson Lee, who views access to health care as one of the most vital issues in the United States to date, has gained additional support of HB 1982. Current supporters of this legislation include Representative Lisa Rochester, Representative Al Green, Representative Darren Soto, and Representative Eddie Johnson. There is no information available today in regard to representatives seeking to oppose this bill. There are, however, representatives who have taken a strong stance against gun control efforts in the past, one such representative being Congressman Mark Meadows. During his 2012 campaign, he was quoted saying, "I will oppose liberals' efforts to create a national gun registry and any other anti-gun legislation that erodes our gun rights." This statement hints at the potential opposition that HB 1982 may receive once it reaches the House floor. Issues such as cost of health care and the impact of gun violence has risen to the surface during the past few years. As Congress and medical professionals seek solutions to these problems, it is essential to understand how individuals with untreated mental illnesses contribute to those costs. By improving access to mental health services and keeping guns out of the wrong hands, we could both promote economic growth and reduce the cost of care in the long run. In the United States, less than half of the adults and children with a diagnosable mental health illness receive adequate treatment. When individuals experience chronic mental illness without receiving treatment, the economic and personal losses can be vast. This includes premature death. According to the National Alliance on Mental Illness, individuals living with a chronic mental illness will die on average 25 years earlier than those without a chronic mental illness. They also have an increased risk for developing chronic illnesses, loss of productivity, and increased rates for disability. It is estimated that $193.3 billion in earnings is lost every year related to serious mental illness. The correlation between physical illness and mental illness has been thoroughly documented. However, it remains largely ignored by medical professionals. If we promoted the importance of mental health to the same degree in which we do other health measures, there is a strong possibility we would see a reduction in the development of costly chronic health issues in America. Further indicators for the failure of our mental health system include the large number of incarcerated individuals with mental illness, the opioid crisis, and the increasing rates of suicide across the globe. Approximately 90 people die every day as the result of gun violence, and many more are injured. This loss equates to an economic cost that exceeds $2 billion annually. Research indicates that mental illness is only a small contributing factor in interpersonal gun violence. However, it is a huge component in deaths related to suicide. A study performed in 2013 showed that suicides and non-fatal suicide attempts costed the U.S. an average of $116 billion during that year. Some might oppose the gun control aspect of this bill in an effort to protect their Second Amendment right. The question that must be answered is, what is more important, protecting citizens who are unable to protect themselves while positively impacting our economy, or appeasing the staunch opponents to gun control? Getting HB 1982 passed into law would only be the first step in ensuring appropriate measures have been taken. Outcome data would have to be tracked from both the gun control and mental health access component of this bill. We would have to track impact on suicide rates, impact on the opioid crisis, impact on disability rates, utilization of services, impact on hospital readmission rates, the economic impact, and impact on treatment compliance. On the gun control component, we would have to monitor suicide rates related to gun violence, rates of interpersonal gun violence, the impact on affected individuals, how many individuals met reporting criteria, and what was the economic impact. If HB 1982 were to be passed, there would be some implications to the nursing profession. With additional funding, outpatient mental health providers could increase their staffing, expand their services, and offer medications at a discounted price. This would make obtaining appointments easier and help with overall treatment compliance. Just as we have tools to measure risks for suicide, violent behavior, and self-injury, we would also have to develop tools to identify individuals who met reporting criteria. In order for this bill to work, nursing staff and physicians alike will have to become more comfortable discussing mental health issues with patients, specifically asking about access to firearms and identifying red flags. When considering additional items of education, it is evident that there needs to be more education in the overall management of individuals experiencing a mental health crisis. Implementation or an emphasis on education programs such as mental health first aid could assist with the early identification and management of individuals in crisis. Programs that focus on awareness and eliminating the stigma associated with mental illness would build a bridge for individuals who prior to this feared seeking care because they didn't want to be labeled. There would need to be strict criteria in place for reporting, and medical professionals would have to be educated about how to proceed and when to report. Moving forward, there would be many avenues for research. Some items of particular importance would include utilization of services, percentage of gross domestic product spent on healthcare, rates of treatment compliance, suicide rates, and the percentage of gun-related violence. This research can help to identify if the bill has made a positive impact and if future interventions are needed. The passage of HB 1982 would not completely fix the many issues that are currently present in the mental health system. However, it would be a step in the right direction. The system needs to be revamped to increase not only the availability, but the quality of care. By reducing the disparities in care often seen amongst those diagnosed with mental illness, we could positively impact the economy by reducing disability rates, increasing personal productivity, lowering the cost of health care, reducing the development of chronic illnesses, and lowering the rates of premature death in the United States. With the addition of the gun violence prevention component of this bill, there is a potential to see a reduction in suicide rates related to firearms. Regardless of this bill being passed, more education is needed for the general public and healthcare professionals alike to identify individuals in crisis and to minimize the stigma associated with mental illness. Education would assist in removing potential barriers to care. In conclusion, I would like to leave you with this thought. As you have watched this video, at least one person has lost their battle with mental illness, and before this day is over, approximately 123 people will join him or her. It's too late for them, but it's not too late for others. I would like to encourage everyone to take a stand for those who are unable to take a stand for themselves. Thank you.